Well, they say mom knows best, and for brand new moms, a doctor's advice is crucial. But a recent study shows that doctors are actually giving little or even conflicting advice to moms. For instance, 75% heard nothing about pacifier use, 50% heard nothing about where babies should sleep, and 20% heard nothing about breastfeeding. And for 10%, nothing on vaccinations. So what are the questions that new moms absolutely need to ask? Joining us now, pediatrician Dr. Suzanne Caseta is with me now. Doctor, thanks for being here. So when you read that, the moms are leaving with the baby, but not really getting a lot of information. It's startling. So for moms out there right now who are headed to the pediatrician, the first question you say that should be asked is what? What is the recommended vaccine schedule, if they haven't heard it?
Well, I think it's very important to ask your pediatrician about vaccines. Vaccines are simply the best way to protect your child from harm. And there is a vaccine schedule, and it's really important that you know what the schedule is, and there's a reason for that schedule. And you want your child to stay on that schedule. It's based on research, it's safe, and it's effective, and it keeps your child very safe.
Okay, what about when the baby gets home? Where should it sleep?
Sleeping. The American Academy of Pediatrics recommends the baby sleeps in your room, but not in your bed. Co-sleeping is not recommended, so you can have a bassinet that's near your bed, but not in your bed.
And then another question that a new mom could ask is, what about sleep position? You know, some people say, well, my baby sleeps better this way or that way. Bring this question to your doctor, and you say what?
Right. This is a very important question to discuss with your pediatrician. You should lay your baby on their back. Always, not on their side, and definitely not on their belly. And one thing that's really important for a pediatrician to tell you is that if the baby goes to somebody else's house, let's say a babysitter, that they know the same thing. Because it's very dangerous to have a baby that always sleeps on their back suddenly sleep on their belly. High incidence of SIDS.
Okay. So make sure that they bring that to someone's attention immediately. Also, recommendations for infant and toddler car seats. That's something you should definitely bring to your pediatrician.
Absolutely, because there are many different choices out there. There's lots of different car seats, and some are more expensive, some are less expensive, and really none are better. Like a $500 car seat doesn't mean it's great.
Okay.
Babies need to be facing backwards until at least 2 years of age, so you want to get a car seat that will fit in your car until the baby's a lot bigger, if you can, because then you avoid buying many car seats.
And even install it properly. I mean, you can have the best car seat in the whole world. If it's not put in properly, then the baby's at risk.
One of the biggest
something to ask your pediatrician as well?
Yes, absolutely. One of the biggest things I tell people is to read the directions.
Dr. Caseta, thank you for joining us today.
Thank you very much.
Great work for moms.